Welcome to another iGeriCare.ca live event. Today is June 25th, 2020. This is our 20th and our last event for the summer season. And today's topic is a little bit different. We spend a lot of time on some of our other topics where we discuss types of dementia or signs and symptoms, the different medical approaches. Today's topic is really just as important. It's about how to promote brain health and reduce risks of developing dementia, or perhaps reducing some of the risks of secondary progression of dementia. So today we will be joined by co-founder of iGeriCare, geriatrician Dr. Richard Sztramko. He'll be joining us right now. So welcome, Dr. Sztramko.
Hello. Well, thanks to see you, Dr. Levinson.
Hope you and your family are keeping well. And today's topic, as I was just saying, is about promoting brain health. And we'll be talking about the impact of specific health conditions, lifestyle choices you can make, such as your level of physical, social, and cognitive activity, and things you can do to help reduce the risk of developing dementia or slow its progression. And I was saying that this is kind of a new topic in some ways. I think in the past, people really didn't think of dementia prevention in the same way. So it's kind of exciting that there have been more recent studies in this area. And as we'll talk about, you can make a substantial impact on risk reduction, probably even cumulatively by following some of the 6 key ways that we'll talk about. As always, the format today, it'll be roughly about a 15-minute preamble. We'll talk about some of the specific approaches to promoting brain health. And then we're anxious to get to the Q&A because we got a lot of excellent questions sent in by people before the live event. So we want to have a chance to answer all of your questions. If you want to submit questions, if you're watching us on Facebook, you can submit through Facebook. If you're watching on iGeriCare.ca/events, you can use the little chat bot to submit your questions and they'll come through. So let's dive right in. I'm going to put up a slide and kind of highlights the 6 ways that we'll be talking about today in terms of promoting brain health. So, physical activity, weight management, managing blood vessel health, diet, nutrition, stopping smoking and alcohol in moderation, cognitive and social activity, and then we'll talk briefly about some of the specific medical conditions and side effects. So why don't we dive right in there? And Dr. Sztramko, is it fair to say really that exercise is maybe about the closest thing we have to a miracle treatment in medicine?
Absolutely. And the closest thing to the fountain of life. I definitely think so. I mean, we've listed a lot of the benefits here. So improving bone health, lowering the risk of heart disease, improving your mood, both kind of immediately and long term, decreasing your risk of falling, and maintaining brain health, which is very important. We talk about in our lesson in terms of being able to boost certain levels of chemicals within the brain, which appear, at least on the surface, to help with kind of nerve cell growth and maintenance of the connections of the brain. Immediately after exercising, you do notice benefits in terms of your cognitive performance. And then it does seem that people that are more active throughout middle life actually have a decreased risk of developing a neurodegenerative condition like dementia related to toxic proteins. And then indirectly, if you're doing physical activity, you lower your risk of heart disease and therefore lower your risk of lower your risk of stroke as well. So that can decrease your risk of cognitive impairment. And I definitely kind of point out the bone health and risk of falling side of things. People don't usually care as much about those things, but if you have a fragility fracture because of thin bones or osteoporosis, and you fracture your hip, that really does impair your quality of life. And having compression fractures in your spine as well, it kind of starts a very vicious downward spiral. So you're doing it for so many reasons, in particular your brain health. But there are a lot of benefits to the physical activity side of things.
And Dr. Sztramko, I'm not sure if there's any way you can maybe boost your audio levels a little bit, but I want to hear more what you have to say. So one of the things that it has recently come out are these Canadian physical activity guidelines. So if you're looking really for very specific guidance on, I think it's one of those things, well, okay, I should be physically active, but what exactly should I be doing? These Canadian physical activity guidelines on the screen are the guidelines for adults. And basically, if you're aged 18 to 64, you should be doing at least 150 minutes of moderate to vigorous intensity aerobic physical activity per week in bouts of 10 minutes or more. So when we talk about aerobic exercise, these are things that kind of improve your stamina. And when it's moderate to vigorous intensity, imagine that if you were doing this, either walking briskly, being on a treadmill, jogging, you would probably have some difficulty sort of speaking without losing your breath, because you're working hard enough that you're in that moderate to vigorous intensity phase. And then it's shown to be, just as you were commenting on, even in terms of bone health, it's really beneficial to add some form of strength training, muscle and bone strengthening activities, using your major muscle groups at least 2 days a week. And basically, as long as you can do these activities safely, more is better. And the Canadian physical activity guidelines, they also have for older adults, and they're actually pretty similar. That again, that 150 minutes, moderate to vigorous intensity, and again, adding the muscle and bone strengthening. If you've got poor mobility, doing things to enhance balance and prevent falls has also been shown to be beneficial and recommended. So things like yoga, tai chi, balance postures, balance classes. So once the physical distancing, is over, a lot of people really enjoy both the social benefits as well as the sort of therapeutic benefits of doing group balance classes. And again, the more the better. So I don't know if you want to comment on the guidelines at all.
No, and I think this is, well, sorry, yes, I guess. Um, I think sometimes people will look at 150 minutes and be like, oh my goodness, like if you're starting from scratch, it's really hard to go through those behavioral change steps. So, don't feel like you need to start sprinting or running 10 miles a day. Just try and pick off the 10-minute chunks of
Yeah.
time they're describing there. So start low, go slow, and don't be scared to ask other people for help.
I think the other thing too is picking something that you enjoy doing, because it's, as far as behavior change, you'll be more likely to do it. And this is where it's also beneficial if you can find a family member or a friend. And again, something, obviously we're in unusual times in terms of the physical distancing and public health guidelines, but at some point we'll be able probably to participate in some group activities. And I think it's been shown that it's easier to stick with some of these physical activity recommendations if you have some friends for kind of joint motivation. So let's talk a little bit about, I guess, diet, because I think the two pieces of diet and exercise do go together. And the Mediterranean diet, which I guess from a common sense standpoint, it's pretty much what you'd expect. It's foods that are commonly eaten in the Mediterranean regions, like Greece or Italy. And I think in general, with respect to our North American diet, and obviously it varies by individuals and families and cultures, but in general, I would say in North America and Canada, we tend to eat more red meat than the Mediterranean areas, and we tend to use more salt in our food, or buy store-bought prepackaged food that tends to be heavily salted. So those are some of the key elements that are beneficial about the Mediterranean diet, that has less red meat, really just a few times per month, more fish, poultry, and vegetables, fruits, healthy fats, less butter, more olive oil, and then substituting herbs and spices instead of using quite as much salt. Anything else you want to say about sort of diet?
It is, I mean, highlighting how the quality of the evidence related to the Mediterranean diet in cognitive performance. So one is like decreasing your risk of developing dementia, but there have also been some studies, not perfect evidence, that when you transition to the Mediterranean diet, or you eat the Mediterranean diet versus the North American diet, your cognitive scores improve as well. And then all of the other benefits too. So just like physical exercise, this diet decreases your risk of having a heart attack or a stroke or some cancer. So it's pretty much the best diet you can think of.
Yeah, and there's been a few other variations on the Mediterranean diet. There's one called the MIND, MIND, that has a lot of similarities to the Mediterranean diet. It has a couple of other antioxidant foods sort of thrown in, but it's comparable. And again, there's maybe not quite as much evidence as around the Mediterranean diet, but an increasing body of evidence around the benefits of Mediterranean diet and mind on cognitive outcomes. We've alluded to this along several lines, but when we talk about dementia, we talk about a subtype called vascular dementia, but many of the conditions that are associated with blood vessel health may also lead to cognitive impairments. And, these are some of the things that one can do to optimize your blood vessel health. If you have high blood pressure, managing it. If you have high cholesterol, if you have diabetes, managing your sugars. But the other things that we've talked about in terms of diet and exercise can also help to optimize blood vessel health.
I think too, just mentioning the weight management side of things too. So we kind of discussed um, the exercise part, but sometimes managing your weight is also helpful. So obesity has been linked to increased risk of developing dementia later in life. So staying healthy, maintaining a positive body image for sure, but also trying to manage the weight in that setting or circumstances. And then out of these three kind of big areas which really impact your likelihood of having blood vessel damage, the strongest evidence is probably around blood pressure control. So as healthy as you could possibly do it, or as safely as you can do it, getting your blood pressure levels down um, to lower levels can really reduce your risk.
Yeah, and there was just a recent study looking again at that linkage between blood pressure management and dementia. Again, just as you said, really showing that association. And so, this is depending on where you are, your age stage. This is a good time to get these things checked and continue to manage them to keep them under control. So, alcohol was on the list, and I think one of the things that is worth talking about is in that Mediterranean diet, it's sort of optional whether you include kind of light to moderate drinking. But I think the key here is really moderation, and we'll talk a little bit about the low risk drinking guidelines. But I think it's also worth just highlighting, what do we mean when we talk about a drink? We in the medical terms, we talk about a standard drink, but I think sometimes when people are just freely pouring, they don't necessarily think in the same way about a drink. So a drink is like a bottle of beer, so 341 mLs, or a bottle of cider. A glass of wine, a standard drink is 5 ounces of most wines. And then for hard alcohol or hard liquor, distilled alcohol, 1.5 ounces is a drink. So 1.5 ounces has essentially the same amount of alcohol as a 5-ounce glass of wine or a bottle of beer. Really the sort of, these are safer drinking tips, but when we talk about low risk alcohol consumption, it's really no more than 10 drinks a week of those standard drinks for women, and no more than 15 standard drinks for men. But some of these other tips, like have at least one non-drinking day, so it doesn't develop a habit into a habit. On any special occasion, no more than 3 drinks for women or 4 for men. So these have been shown to be useful tips. And here are some sort of tips that can help you to cut down if you are having trouble controlling your alcohol consumption. Any other thoughts or comments?
I think it's really important that you pointed out exactly what it means for a standard drink, because very frequently in clinic, we will ask people, how many drinks do you have a day? How many drinks do you have per week? And what does that mean? And they'll say, oh, I have 2 rum and cokes. But then when you dig a little bit deeper, they do a free pour and it ends up being 3 or 4 ounces. So they're actually consuming 8 ounces a day. And people always underestimate the amount that they're consuming. And it certainly has the long-term impact on your risk of developing dementia, but immediately it does disrupt your sleep and causes, acute intoxication, increases your risk of falls, increases your risk of motor vehicle accidents. So one of those things where, because it's a lifestyle choice that's very culturally accepted, sometimes we'll downplay it or think that it's not that big of a deal, but it can have immediate, large impacts in improving people's quality of life, as well as reducing their risk long term. And then also, I don't think people are quite as aware of specific physicians or counselors that deal with alcohol consumption. And so there's a whole spectrum from complete alcohol dependence to using it inappropriately. So we can facilitate as physicians getting access to resources to help you cut down. So I don't think you have to do everything by yourself again.
No, excellent point. And I think, the linkage between alcohol and other health conditions as well, not just the effects on blood pressure and weight management. So probably an underestimated issue. And I think also often with older adults, we're almost reluctant to ask or screen for alcohol use in that way. I guess the other thing that should be pointed out, just as we're talking about, we didn't talk about smoking, but basically, I don't know that there's anything redeeming one can say about cigarette smoking. What we do know is there are a large number of poor health outcomes and other conditions associated with it, and that smoking cessation is one of the best things you can do for your health and one of the best things you can do to promote brain health and reduce your risk of dementia as well. So again, you don't have to quit on your own. You don't have to go cold turkey. There are counselors, and we have a smoking cessation hotline available to people in Canada. Most public health agencies offer help on that. For people who are really struggling, there's evidence that additional treatments can also help, whether it's nicotine lozenges or gum or the patch. For some people, those can also be helpful for cessation. And I guess the same is really true of alcohol use disorder. In addition to counselors, there's some medication treatments for people who have an actual alcohol use disorder. And addressing these risk factors can help to reduce your risk of developing dementia, as well as the other health conditions they're associated with.
I do find it interesting. I'm not sure if you feel the same way, but people are very conditioned to think about smoking and lung cancer or high blood pressure and heart disease. It's kind of these lifestyle decisions or patterns of behavior really impact all facets of health. So generally in the public, they're very aware of certain risks and certain diseases, but if you want to protect your brain, which you definitely do, these are so important.
I agree. It's a bit of a mind shift to be thinking now about promoting brain health and protecting your brain. And I like this concept of really dementia risk reduction or prevention. So, I mean, there's a ton of different health conditions that can, managing those health conditions can reduce the risk of brain impairments. Depression is a treatable condition, but there's definitely an association between people who have depression, especially in older life or recurrent depressions, and risk of cognitive impairments. And it's treatable with both medication and non-medication approaches. Things that affect sleep or conditions that lower your oxygen. Your brain is a big consumer of oxygen, arguably the most voracious in the body. And so conditions that affect blood oxygen levels like COPD or common one like sleep apnea, again, are things where people may actually notice cognitive impairments. And, like with blood vessel health, your brain needs a certain amount of oxygen to function at its best. Um, Hearing loss is another one where it probably impacts on a number of different domains, and is absolutely something that we talked about. We had a whole live event really talking about the relationship between hearing and dementia. But from a prevention standpoint, this is one where you can get your hearing checked. There are interventions that can help. Um, any other comments? I mean, we've talked previously about certain medication side effects, but this is another area where people may notice cognitive impairments and worry that they're developing dementia when actually, if their medication adverse effects were better managed, they might have substantially better brain function.
No, other than I, as a clinician, like seeing things that I can intervene on and improve people's qualities of life or quality of life. And so having people more aware of these things and hopefully either getting off medications or if they feel like something's wrong, being able to advocate with their physician for the medical conditions that they've had. And I don't know if I've shared this anecdote before, but I had a woman who was falling repetitively and had some memory and thinking problems. And people thought that she had Alzheimer's disease. Well, she had untreated lung disease or chronic obstructive pulmonary disease, and all she did was, get her lung disease treated, and her cognition improved substantially, and she stopped falling because she could get more oxygen into the rest of her body. So these are very important foundational
Yeah.
issues that need to be addressed if we're trying to improve cognition.
Yeah, and I could tell you similar stories for people who were so severely depressed that their thinking was so slowed down that they looked as if they had dementia, but with successful treatment, their cognition, returned to normal. And actually, the same can be said for people who have, say, had long-term chronic exposure to certain medications like benzodiazepines. These are drugs like Ativan or Rivotril, Cirax, Xanax, ones that tend to build up in the brain and can take a long time to sort of clear your system. It's the same with certain narcotics or opioid painkillers. So people will look like they're very cognitively impaired, but if you give them a washout from some of these medications, their cognition can return to normal. So I think those are really the key points we wanted to say. We have so many great questions coming in and ones that we wanted to address, but I think we really wanted to highlight these 6 ways to reduce your risk. And interestingly, for I guess it's the first 5 of these, there was a study done looking at these kind of factors. And, if you were able to commit to sort of 4 out of these 5 ways, you could reduce your risk of developing Alzheimer's disease by 60%. So these kind of lifestyle and healthy active living approaches actually can have a substantial impact on reducing your risk of developing dementia. All right.
It's nice to
I'm
have
going.
hard and fast numbers on that as well, too, right? It's not quite so vague. It's like, hey, if you do these things, you can really have a major benefit in your life, as opposed to, well, we don't really know. It feels much more comforting to me to be able to have that information.
I agree. Okay, so let's move to some of the. I'm going to move to some of the questions that came in live, and then we'll get to some of the questions that were sent in. One of the questions that came in when we were talking about diet was whether or not there was any evidence around the paleo diet or wheat belly gluten-free diet, not packaged gluten-free, just clean eating with coconut oil, olive oils.
So I think the paleo diet and the rest of the diets, there's other than the Mediterranean diet and the Mayan diet, the one that we presented, there's no specific evidence that you can benefit. There are rare circumstances, and I think this is the problem with gluten intolerance and celiac disease in general, is that there's much more of a tendency to overcall the importance of it. However, that being said, there are neurologic disorders associated with celiac disease. So if you go to your physician and you get tested and you're positive, either in the blood tests or you have biopsies of your small intestine done, proven celiac disease, there might be a link. But that is so rare
Yeah.
that we tell people not to overcall it and saying, "Oh, I'm just gluten intolerant, and that's why my brain isn't working."
Yeah, I think what we can say, as you put it, is right now, in terms of the evidence for dementia prevention or risk reduction, cognitive improvements, the evidence supports the Mediterranean diet and the variation, the mind diet. There's a little bit of data around the health benefits of the DASH diet, which is sort of the low sodium diet, which is probably helpful to some degree for people with blood pressure issues. Some of those elements that you mentioned in this question, like coconut oil, those have not been shown independently to be beneficial. So I think we could just say there's no particular evidence at this time, but it may not have been systematically studied. There was another question when we were talking about alcohol, about the concept of alcohol-induced dementia. And actually, somebody else answered it talking about Korsakoff. So actually, there are several different ways in which alcohol can lead to various types of cognitive impairments. So you may have, as we were talking about, you could have alcohol intoxication, which would impact on things. You can have alcohol withdrawal, which is often associated with confusion. You can have a syndrome known as Wernicke or Wernicke-Korsakoff, which is a combined syndrome. In Wernicke's, you have a thiamine deficiency acutely, which presents with a lot of confusion and problems, following, tracking with eyes, and tremendous unsteadiness. And this is probably quite a bit more common, and alcohol impairs the ability to absorb thiamine. And so it's very important, if you identify that, we see cases in the emergency, that they should be treated immediately. If they are not treated, it can go on to develop what we call a Korsakoff syndrome or amnesia. And this is the inability to actually form new memories. So it's a incredibly disabling condition, which is why it's really important to recognize acute thiamine deficiency and manage it. But even apart from that, alcohol itself seems to be directly toxic to the brain, and long-standing chronic alcohol use will contribute to an alcohol dementia in some patients, separate from Wernicke-Korsakoff. We have another question here from my reading. The research.
The other thing would be the long-term damage to the liver. And then you'll have both things happening, where people will have damage to the brain, but their liver won't be processing things. They may have hepatic encephalopathy or cirrhosis, hepatic encephalopathy from their cirrhosis as well.
Yeah, and that's a condition where the acute liver failure leads to a buildup of toxic substances, and those cause confusion and other symptoms. So. There's a question here. From my reading, the research isn't clear, but what are your thoughts on the impact of wearing a mask and brain oxygen levels?
Yeah, so I mean, there's nothing with respect to oxygen saturation. So we wear masks all the time, but so there's nothing to suggest that your brain oxygen levels go down wearing masks that I'm aware of. So.
Yeah, I mean, I think it may speak to for people who are wearing face coverings in the community, if you have some kind of respiratory issue, you may want to try a few different masks or face coverings, because not all are created equal. So there might be ones that are maybe a little bit more almost claustrophobic, but to my knowledge, with standard kind of medical masks or whatever, there's never been shown to be any drop in oxygen saturation levels.
I do
Uh,
note, just to make the other point, that the sensation of breathlessness or dyspnea is different from having low blood oxygen levels. So certainly masks can make certain people feel claustrophobic or make them feel like are going to faint or that they can't breathe as well. But that's different than having low blood oxygen levels. So just like you said, find something that works for you in terms of a face covering, but don't worry about the oxygen levels themselves.
there's another statement here. Can you talk a little bit about sugar metabolism, diabetes, insulin resistance, and brain health?
So I'm not an expert in this particular field, but there have been multiple kind of um, animal models which show that there's some relation between glucose metabolism in the brain and insulin. There were trials where they used intranasal insulin, though, to try and regulate the blood glucose metabolism and see if higher insulin levels could have some impact on cognition. But unfortunately, they weren't positive. So it's another one of the areas of active research where people are trying to figure out what the biologic and cell level mechanisms are for Alzheimer's, but we haven't, and we have hints and we have clues, but there's been no focused answer to how we can intervene and improve somebody's brain health with respect to that.
Um, I understand we're not experiencing it in terms of how Richard and I are interacting, but I think as the broadcast is going through on Facebook, I think there's some audio interference. So apologies for that. We're not hearing it. So life is great where Richard and I are conversing, but we'll do our best to speak loudly and clearly, and hopefully it can overcome some of the fan interference. I assume that meant that they were fans of Richard's that were knocking on his door, but it's apparently an audio issue. There's a number of great questions that got sent in. My husband takes donepezil and memantine. Would any of the brain boosters or vitamins that I always receive information on help him at all? Thanks for your consideration. And this is a question that I guess we get quite often. There's been a lot of research done looking at various vitamins and supplements. And, unless you actually have a true diagnosed vitamin deficiency, like we talked about, some people with alcohol use disorder may have thiamine deficiency. We usually test in people with dementia. We test for vitamin B12 to make sure that somebody doesn't have a B12 deficiency. In the absence of a true vitamin deficiency, there's really no convincing scientific evidence for supplementing with any other vitamins or brain boosters. So I don't know if you've heard anything different about anything else, but I don't typically recommend that. So.
No, I agree.
Another question, is it true that eating certain foods and exercising will help lower risk to dementia? Yes, so I think we really talked about that. One thing that's interesting as well, and we didn't actually talk, we left off talking a bit about the importance of cognitive activities and social activities. So those are other important things that you can do to reduce your risk. And there's some evidence that actually combining cognitive activities with exercise or physical activity may have like an additive benefit. So these are substantial things that you can do. Here's another question. My husband has a series of severe concussions with normal for his age MRI and scans. He's been diagnosed with late stage dementia, but he has had some improvement with laser treatment and has short-term memory most times. I'm not sure what the laser treatment would have been. X-ray shows severe neck injury restricting blood flow to the brain. Would it be possible he doesn't have dementia, but low blood and oxygen flow to the brain? And if so, how can he be helped?
Hmm. It's a good question. There are low flow states where people have blockages in the arteries that lead up to their brain, which may impact cognition. It's hard for us to measure those and be precise. Just knowing if there are severe blockages, they may contribute. If there is neck injury and it's the blood vessels at the back, so the vertebral arteries at the back, usually people will present with difficulties swallowing or dizziness, vertigo. They may have nausea and vomiting, or they may have challenges with their vision because the back part of the brain, which is fed by those arteries, is responsible for your vision. So it's not particularly memory issues and short-term memory issues. It would be presenting as different symptoms. It is also quite common for people to have uh, atherosclerosis, which is the narrowing of the arteries related to cholesterol buildup, and it having no impact. So as we age, all of us will develop those cholesterol deposits, and sometimes it has nothing to do with causing heart troubles, or it has nothing to do with causing brain troubles. So it's really how much of it is there, where it is, and what the symptoms should be. And based on what we're hearing, it doesn't sound like those two things are related.
Um, Here's another one. As we know, prescription drugs can have side effects that include a brain fog or short-term memory loss. Gabapentin, for example, causes depression and confusion in some. What can be done either through diet, supplements, or exercise to counteract this? So I guess what I would say is, as we've seen, diet and exercise are excellent, and there's good evidence to support their role in sort of reducing the risk of dementia. The issue, less evidence or no evidence around particular dietary supplements per se. I think this is an issue more around management of the prescription medication. These are, where you have an adverse effect, you need to say, okay, well, is this a dose related adverse effect? If we reduce the dose of the medicine, is there less brain fog, but still the therapeutic benefits? Or is this somebody who just can't really tolerate this particular medicine, and the benefits are outweighed by the adverse effects, and maybe there's a role for looking at an alternative medicine, or just taking the person, as we've talked about, deprescribing, taking the person off that medicine and just saying, okay, there were some benefits, but we're not happy with the adverse effects. So
It's funny. Well, it's not funny. It's interesting to see too. Some people might be on a pain medication for narrowing of their spine, and with pressure on the nerves, they have spine surgery, and the compression is removed, but they'll stay on the medications. So there are medications that people don't need anymore, and there are also medications that are inappropriately prescribed. So gabapentin is very specific for nerve pain, and there may be people that don't have any indication, and so there's no reason to be on it, and you can find a better medication. So
here's a question. Do you think ginkgo biloba and or resveratrol have a role in brain health? What supplements help? And you and I recently kind of reviewed the scientific literature on supplements, and there's been a lot of different vitamins and supplements studied, including ginkgo biloba, all manner of vitamins, looking at whether they can actually prevent dementia, reduce the risk of developing dementia, or prevent further decline in people who might have mild cognitive impairment. And really, we did not find any substantive evidence to support the use of any of these supplements. Here's another one that came in. My husband's been recently, 2 years ago, diagnosed with Alzheimer's. However, he's had 2 MRIs, both saying there is chronic microangiopathic disease, MRI number 2, and microangiopathic ischemic demyelination in MRI number 1. He's had 3 episodes of TIA-like symptoms. I understand from reading this pathology seems to have been only fairly recently studied thanks to MRIs. As I understand it, this process then results in neuron death from lack of oxygen, blood, etc., or even plaques. And then this results in manifestation of symptoms, cognitive decline, and other dementia like signs. My question is, would this condition benefit from drugs like Plavix or warfarin or anti-inflammatory drugs, or ensuring a really low blood sugar, lower than what would be considered normal for most people?
Um, that's a great question. It's a multi-parter. So just describing the chronic microangiopathic disease, which is damage to small blood vessels. It's one of those things like the narrowing of the arteries we discussed that is very common just with age. So usually you'd see moderate or severe levels of that damage before it would impact um, somebody's cognition. So we see it all the time on scans from people that have no cognitive impairment whatsoever. But if you have moderate or severe disease, you get what's called a subcortical dementia. And what we mean by that is people have more frontal lobe related findings. They can't plan things, they can't multitask, they can't switch between things, between activities. They may get more apathetic or withdrawn, and they may get depressed. That looks very different when we hear a story than somebody that comes in with short-term memory problems, and that they're losing objects or they're forgetting conversations. They have problems with fine motor movements. They have word finding difficulties, and they may get lost or wander. They're two very different things. The first one is what you commonly hear from a subcortical dementia, where people have the microvascular disease, versus somebody that has Alzheimer's disease, which impacts the back of the brain more predominantly and the temporal lobes with respect to memory. So I'm not sure of all the symptoms, but those two things are differentiated. With respect to the microvascular disease, there have been no clear interventions that have stopped its progression. So you do the same things you would do for blood vessel health. So if you've had a previous stroke, perhaps an aspirin, control your blood pressure, control your blood glucose levels in reasonable limits. There's no evidence to suggest that lowering the blood glucose level further than is required for normal diabetics is advantageous in that setting. So I hope that answers your question.
Yeah, I think that's a great answer, and I think it's important to keep in mind too that we do make clinical diagnoses on the basis of the history and physical exam, and in some cases uh, brain imaging. But often people may have a mix of different types. So this may be somebody with a mix of both Alzheimer's disease and possibly a contribution from vascular dementia as well, in terms of evidence of this small blood vessel disease. Yeah. So, we've got time for a couple more questions. What is the link between recreational programs and the progression of dementia, if any? Has this been shown as a successful treatment in absence of cure or medicine that stops the disease? I think we talked a little bit, or I mentioned the importance of cognitive activity and social activity as a risk reduction kind of intervention. So recreational programs in people who are healthy may be beneficial as one of the ways you can promote brain health. And I think there's a rationale for why this would also be of benefit in people with mild cognitive impairment or dementia to continue their engagement and both social and cognitive activity. I don't think there's been very, very strong evidence of it as a treatment, but it might help to keep somebody in living with dementia engaged, and may or may not play a role in helping to slow the progression. I guess conversely, we know that social isolation is associated with worse outcomes, mental health issues like depression, and increased association with dementia. Not sure if there's anything else that you wanted to say about that.
Oh, I think you put that very eloquently. We always struggle the difference between an association and an actual treatment that modifies outcome. So
Here was another one that just came in. With Lewy body dementia, can there be scent or olfactory or smell hallucinations? My father has no sense of smell, but was convinced he could smell strong cigarette smoke when there was none.
Yeah, I mean, an interesting question. So yes, absolutely, you can get other forms of hallucinations. There are core features associated with dementia with Lewy bodies, which include visual hallucinations, which are generally well formed and within the person's central visual field. They could be people, they could be animals. Sometimes they're distressing to people and they are really bothered, and sometimes people can just understand that they're there and not be distressed by them. But under the supported features categories are tactile hallucinations, where people can feel things, auditory hallucinations, where they can actually hear things, and then gustatory, where they can taste things or they can smell things. And it is common also that people that have Parkinson's disease and dementia with Lewy bodies do lose their sense of smell. It's very specific to those two disorders, or to disorders that are associated with Lewy bodies. And people will often lose their smell before they actually develop the neurologic symptom, further neurologic symptoms, cognitive or motor symptoms.
That's yeah, excellent questions today. We do have some other questions that were a little that had come in that were a little like on topics that weren't as directly related to promoting brain health. I think we'll either do another special segment where we try and answer some of these items, or maybe we'll try and answer some in writing on the website. But we've kind of reached the end of our 45 minutes. I really want to thank everybody for joining us and I guess celebrating our 20th live event. Again, a recording will be made available when we've kind of had a chance to process that, and we'll make it available on the site. There is a survey pinned at the top of the Facebook page. So if you could let us know some of your ideas, suggestions, future topics, that would be absolutely wonderful. This was a suggested topic, and I think a really important one in terms of what people can do to reduce their risk. In addition to thanking Dr. Sztramko, as always, I want to thank the people behind iGeriCare, the Center for the Canadian Center for Aging and Brain Health Innovation, powered by Baycrest, was one of the original sponsors and funders of iGeriCare. The Jerris Center at Hamilton Health Sciences, McMaster University, the Hamilton Health Sciences Foundation, the Alzheimer's Society Foundation of Hamilton Halton, and our team from the Division of E-Learning Innovation that keeps the magic going even as we're all working remotely. And just a reminder to donate. I will make a private thank you and a written thank you to. We've had some success with donations. You can go to the iGeriCare website and keep the magic happening by offering a small donation to help keep us producing new lessons. We have a new lesson in production on the stages of dementia that should be out soon. We're updating our promoting brain health lesson on the site, thanks to contributions from you. So I want to thank everybody for joining us today. We're really looking forward to continuing to bring you top-notch dementia education online going forward. And we'll be taking the summer off, but we'll resume with monthly live events in September. Again, give us your feedback. And as always, teamwork makes the dream work. Thank you all very much for joining.